Hi there. So the medication we're going to be talking about today is called Filgrastim. The brand name of it is Neupogen. And this medication is taken to help the body make white blood cells. This can be after receiving a cancer medication or if you have an autoimmune disease such as HIV or rheumatoid arthritis. It can also improve survival in people who have been exposed to radiation in the past because that can decrease your white blood cell numbers as well. Um, this medication gets the bone marrow to produce different kinds of white blood cells, and white blood cells are what the body needs in order to fight off infection, disease, and illness as well. This medication can be administered through an IV or it can also be administered through a shot, and the shot would be in fat. So it would be probably in the back of your arm or in your tummy or anywhere where you might just have a little bit of extra room for a shot. And we'll want to look at the labs to look at the total blood counts that you have, mostly specifically focusing on white blood cells before taking the medication. And this would help us to know if there's an improvement later and to make sure that the medication is needed because you actually can get too many white blood cells and that can cause its own adverse effects, which we will look at later on. So when administering the medication, the vial that the medication is in should not be shaken and it should not be mixed with any other medications either. It should just be by itself when it's administered. You would also not want to take this medication or give this medication within 24 hours of a chemotherapy treatment. And if you do get adverse effects, going back to the adverse effects I was talking about, some of those can be you can get bone pain and a fever from getting too many white blood cells. And with long-term use, you can actually get an enlarged spleen as well, and that can be a little bit painful and it's not healthy either. So needless to say, while you are on the drug, we're going to want to be looking at your labs about twice a week, looking at those blood counts and making sure that your white blood cell count does stay within a normal range and to make sure that there's an improvement as well with the medication. If you do have a white blood cell count that is too high, we'll probably discontinue the medication. So you wouldn't be getting any crazy adverse effects from that. We would want to discontinue that right away. We'll be monitoring you for bone pain and a fever, so you might want to be taking your temperature frequently, or if you're in the hospital, we'll be taking your temperature frequently. If you are taking the drug long term, we'll probably be monitoring you for spleen enlargement as well. So we want to make sure that that stays within normal range. If you are taking the drug, we would want you to report to your provider if you are feeling that bone pain and a fever. We would also want you to report if you're feeling any fullness in your belly or if you have pain there at all. And yeah, that's about it. Thank you.